So today we'll be talking all about the outbreak of the Marburg virus disease. It's important to note that this disease is very severe and often very fatal in humans. Human Marburg virus infection results from prolonged exposure to mines or caves that are inhabited by specific fruit bats. Another key thing though is that people cannot transmit the disease before they have symptoms, but they remain infectious as long as their blood contains the virus. So what are some symptoms we look out for? It's important to note that there's an incubation period for this virus. So this can vary from 2 to 21 days. So some symptoms to look for are high fever, severe headache, severe malaise, muscle aches, pain, watery diarrhea, abdominal pain, cramping abdominal pain, nausea, vomiting can even begin on the 3rd day. You can also have this non-itchy rash that are reported in some patients between 2 and 7 days on the onset of the illness. And from day 5, patient may develop this hemorrhagic manifestation, including fresh blood in their vomitus and in their feces, bleeding from their nose, their gums, and their vaginas, bleeding at the site where you get an injection or an IV access, and it can also involve your central nervous system where you get confused, you're irritable, and you get more aggressive. A key other symptom is orchitis, which is inflammation of one or both testes. In very fatal cases, death occurs most often between 8 and 9 days after the onset of symptoms, and is usually preceded by severe blood loss or shock. It's also important to note that now we have Marburg virus being spread from human to human through direct contact, like broken skin or mucous membrane with blood, secretions, organs, or other bodily fluids of infected people. And there's transmission with surfaces and material like bedding and clothing that are contaminated with these fluids. Another important thing to note is that healthcare workers have frequently been infected by treating patients suspected of this virus. Burial ceremonies or funeral that involve direct contact with the body of the deceased can contribute to the transmission. In regards to treatment, early intensive supportive care includes rehydration, and treatment for the specific symptoms can improve the survival, but there are currently no vaccine or any antiretroviral treatment approved for this virus. We want to reduce our risk of this disease by reducing our risk of bat to human transmission, reducing the risk of human to human transmission, and the communities that get affected by it should inform the public and the health system so the necessary outbreak containment measures can be taken. Healthcare workers should always take their standard precaution when taking care of patients, including basic hand hygiene, respiratory hygiene, use of personal protective equipment, safe injection practices, as well as safe and dignified burial practices. Marburg virus transmission via infected semen has been documented up to 7 weeks after clinical recovery, and we recommend that these male survivors should follow safer sex practices for up to 12 months.